My name is Tal, and I'm the Educational Director at the American Academy of Functional Health. And in this class, we're going to dive deeper into the gut-brain axis. So we're going to start with an interesting picture illustration from the book Autism Spectrum Disorders, published in 2021. You can see in the picture the bidirectional communication pathways that is occurring constantly between our gastrointestinal system, gut microbiome, and our brain. This means that our brain can influence the function of the gut and vice versa, leading to a change in function. I'm going to illustrate on this whiteboard next to me the several mechanisms so you get a better and deeper understanding on how this communication occurs. I'm going to draw our brain up here, and over here we're going to have the gut. Now, there's a few factors we got to consider with our gut. One of them is the bacteria, gut bacteria, or microbiome. And then we also want to consider the integrity of the gut. And we also want to consider the different metabolites. Now, this is, as I mentioned, a bidirectional communication, which impacts each other. So we're going to take a look at another interesting picture from the Journal of Functional Foods, published in 2024, where we can see the changes in the gut that are associated with mood disorders, neurodegenerative changes, and also changes in our body weight, such as weight gain or obesity. So let's take a look at the three methods in which our gut might influence our brain. So the first one is the gut bacteria. In our gut, we have many types of species of gut bacteria, and each one of them has several functions. If, however, you have a state of imbalanced bacteria because your patient might have been on antibiotics for a while, or the patient is living a very stressful lifestyle, or consuming certain foods or dietary patterns, that can lead to a state of dysbiosis, which essentially what it means is that there's an imbalance between the good and bad bacteria. So this is what in the medical terms is referred to as dysbiosis. Now, dysbiosis can lead to an increase in the lipopolysaccharides. These are proteins in the outer layer of certain bacteria, such as gram-negative bacteria. But those, essentially lipopolysaccharides, they can cross into the blood circulation. And when they do that, they essentially trigger a very strong inflammatory reaction. Now, this could be subclinical, but it is a systemic reaction. Now, while lipopolysaccharides do not directly cross through the blood-brain barrier, the impact of that inflammation, which is secretion or upregulation of certain inflammatory cytokines such as tumor necrosis factor alpha or interleukin-6, for example, can cross through the blood-brain barrier, leading to or contributing to anxiety, depression, sensation of stress, and neuroinflammation, which could contribute to neurodegenerative or cognitive decline, right? So that's one mechanism. The second mechanism that we're looking at is the fermentation of short-chain fatty acids. So those are the metabolites. Now, those metabolites are really important. Those are the short-chain fatty acids. Short-chain fatty acids such as, for example, butyrate, which our bacteria in our gut ferments, are really important because they promote epithelial barrier function, which is, again, what we talked about, the integrity, right? And they also modulate our immune tolerance, which is really important to prevent the overactivation of our immune system, or in other words, chronic inflammation. And so what happens is if we don't have enough of the beneficial bacteria, or your patient's dietary patterns do not support the fermentation of short-chain fatty acids, what will happen is short-chain fatty acids will reduce, which will lead to increase of, it will essentially be more of a pro-inflammatory environment, right? And that's because you got a decrease in butyrate, right, or other metabolites, right? But essentially this will be a pro-inflammatory environment. Third mechanism is really interesting. It's actually the secretion of certain neurotransmitters. Certain species of bacteria in our gut, such as lactobacillus, bifidobacterium, and bacillus, can actually synthesize GABA, serotonin, dopamine, and acetylcholine. And while those directly are not crossing into the brain, they do influence our vagal nerve activity. So this is again another form, another way in which those bacteria influence our vagus nerve. And the vagus nerve is the direct connection between our brain and our gut, while the first and second mechanism that I previously talked about, this and this, is indirect through the bloodstream. And essentially, there are several interesting studies that show that over or under stimulating of the vagus nerve could lead to changes in emotion or cognition. Now let's take a look at another interesting illustration. This is from the International Journal of Molecular Science, and it really shows us a few of the concepts that we talked about, the short-chain fatty acids, the cytokines. And on the other hand, we got from the brain down, we got also the nerval stimulation, neuropeptides, and all of those. So let's take a look at those and at those mechanisms, right? So here we looked at the gut-brain axis from that aspect. So let's take a look again. I'm going to draw here our brain. Now we want to look at it from the other side, right? So we talked about 3 different ways that our gut stimulates or influence our brain function. Now let's take a look at the opposite, right? How our brain essentially influence our gut microbiome or integrity. And so essentially the first mechanisms is through the peristalsis, which is the muscle contractions in our gut. It also regulates the secretions, the gastric and intestinal secretions. So for example, if you have too little stimulation, let's say your patient is under stress, they're eating some foods, and now there's, through the overactivation of the sympathetic system, they're now not secreting enough stomach acid. What essentially over time will happen with less secretion of acid, right, there's less proper breakdown of our food. And what that is associated with is improper overgrowth of certain bacteria, which can contribute to, again, dysbiosis, right? And we talked about what dysbiosis does to our gut, what that means with our gut bacteria, and how does that impact our brain. The second mechanism in which we're going to discuss is the vagal afferent release of acetylcholine. So essentially, acetylcholine is really important. So we're going to put in here acetylcholine. So acetylcholine is really important because it binds to the alpha-7 nicotinic acetylcholine receptors on immune cells, so especially macrophages, right? So this will essentially bind to the alpha-7, so alpha-7 receptors on the macrophages. And what this will do is essentially inhibit the expression of pro-inflammatory cytokines and the release of those pro-inflammatory cytokines, such as tumor necrosis factor alpha or interleukin-6, which again creates an inflammatory environment in our gut. So if there is not enough stimulation, there's not enough release of acetylcholine, what will happen is there's not enough binding, and then now you get a state of overactivated macrophages, which leads to inflammation in our gut. Now, and then the third mechanism essentially is the vagal stimulation indirectly shapes the gut microbiome by altering motility and immune response. Think about it. If there is not enough stimulation from the brain to the gut, and now you have constipation, right? There's not enough motility, which happens in all sorts of conditions, HPA imbalances, hypothyroidism, right? What will happen is, again, you have accumulation now or overgrowth of certain bacteria, which could lead to dysbiosis, right? Now, these are 3 mechanisms, 3 types of examples to show you and have a better understanding of how this system works, right? Now, let's take a look at some strategies for healthy function. If you identify your patient has an imbalance of the gut-brain axis, as I mentioned, mood disorders, neurodegenerative conditions, and cognitive decline are examples of those. IBS is another example. One, we want to evaluate your patient's gut microbiome, integrity of metabolites. Are there inflammatory markers there? Are there sufficient amount of the 4 major metabolites, right? Short-chain fatty acids. Also evaluate signs of dysregulated vagus nerve. Address the root cause. That's what we do in functional medicine. We find and address the root cause to really provide a long-term solution for our patients. If there's dysbiosis, removing the harmful or imbalanced bacteria. Now, in some cases, we're able to use a more gentle herbal approach to using antibacteria. And then we have to support the fermentation and production of short-chain fatty acids. So our patient must eat fiber, fruits and vegetables. That's really important. And then support the gut integrity. For example, L-glutamine, there are certain protocols where L-glutamine will be appropriate. And then, of course, probiotics are a really good tool to support the beneficial bacteria when you use research species. And I wanted to give you an example, a really practical example for using probiotics to support this axis. So here's a really interesting study. It was published in the Frontiers in Aging Neuroscience. And it was a double-blind, randomized placebo-controlled study. One group received essentially a probiotic-enriched milk for 12 weeks, and you can see the different 4 types of probiotics, while the other groups essentially received a plain milk with no probiotics. And the result in the treatment groups, and this was patients with Alzheimer's disease, 60 patients with Alzheimer's disease, the results were really interesting. 3 months later, the mini mental state examination score improved significantly in the probiotic group compared to the control. Second to that, the metabolic outcome, there was a reduce in markers of oxidative stress and improved insulin metabolism. So really great improvement for just 3 months with just one simple strategy, right? And so you can find there's different professional grade supplements, but this is one example, Therabiotic, which is essentially a probiotic that has 12 different probiotic species. 3 out of the 4 strains that were in the study can be found in this specific product. It has high counts of CFU, which is the units of bacteria. That's how it's measured. 25 billion CFUs, and it also has specific patent coding called Intadic. Technology for maximum viability through the intestinal tract. So you can take a look at that. And of course, I would highly recommend to learn the evaluation process of the gut integrity, microbiome, metabolites, all of that, and to identify the signs and symptoms of gut-brain axis dysfunction. So learn more about the specialty labs and the specific protocols. We have 3 really great and comprehensive modules in our advanced functional medicine training, advanced and clinical. So one is the entire foundation of functional GI. The second one is we have a specific module on anxiety, psychobiotics, and neuroinflammation, and an amazing class by a physician, a functional medicine physician, Dr. Caviola, which is called the Gut-Brain Axis, the Science and Clinical Application. So you're invited to reach out to us if you have any more questions about the program, how does it work, and together with a mentor, an assigned mentor, and giving you all the clinical tools, we'll show you how to implement functional medicine in your practice within 3 to 4 months. Thank you for watching, and take care.